My name is Catherine Lord, and I'm here to talk today about global issues in nursing. Global issues transcend national boundaries. We are now connected more than ever because of new technology, international travel, migration patterns. So, boundaries really provide a false sense of security and a detachment from these issues. One global issue arising is infectious disease, which can be caused by changes in evolution, antibiotic resistance, new trends such as anti vaccination, which is causing us to see previously unrecognized illness. And for nurses, this is important to us because we play a critical role in recognizing and responding to these types of outbreaks. The International Council of Nurses made a statement after the famous Ebola outbreak, stating nurses assist government and other agencies to implement and evaluate communicable disease. Nurses have valuable expertise, competencies, and grassroots perspectives to impact the prevention, spread, and management of infectious disease outbreaks. For us, there's lots of education on the American Nurses Association website that provide tools and resources for us to help educate ourselves and the public about infectious disease. Another issue that nurses are seeing today is human trafficking. This isn't new, but it's increasingly recognized because it's the second largest, fastest growing organized crime trade globally. The U.S. is a prime destination because of its profits. So nurses recognize and play an important role in recognizing the risk factors, clinical manifestations, and providing care for these victims of human trafficking. One of the front lines is emergency department nurses, which is very important to me as an emergency department nurse. So we really play the bridge between a victim and the resources for them to get help. And a victim will not always ask for help because they're scared. They're used to emotional and physical abuse. So it's important for nurses to recognize and support and refer these patients to the correct and appropriate agencies. One of the biggest problems that nurses face today is a lack of adequate training in this area. And public awareness is very important for nurses to see what's in the news and not just see it as something that's happening, but get involved. Other global issues in nursing just include maldistribution of healthcare workers, poor infrastructure, social injustice, inequality, and poverty. There is a growing shortage predicted, as well as an increase in global population. In 2013, the World Health Organization estimated a shortage of 12.9 million healthcare workers by 2035. And by 2030, there should be around 8.5 billion people on Earth. So there simply is not enough supply for the demand, and the gap is always widening. A maldistribution of healthcare workers or providers not only means not enough of providers for the people, but also a misalignment in the number of skill sets of workers compared to the demand for services. It's also difficult for some patients in rural areas to reach providers due to terrain, lack of transportation, distance from the provider. And in these areas, delay of care means poorer outcomes, intensive and expensive treatment, because these patients will wait until they cannot wait any longer to get care. So as a nursing leader, it is important to react to this call to action for nurses, to think as an individual on a population in a smaller scale into a global scale. We have the impact to fight global healthcare issues by being innovative, taking initiative, being accountable, leading by example, and setting clear expectations. I've learned from this assignment that I am not a follower. I don't just do what the doctor tells me. I can join organizations. I can vote for politics that really have a hand in the healthcare industry. and telling what I believe should be right about my patients and advocating for them, because the more that people hear, the louder the message is. So as a nurse, you have a role in changing policies and the education for others. You're not just someone who is a small bedside person. You have a big role in what you do. Thanks for listening. Have a great one. Bye.